Glucose testing is one of the most important tools we have in clinical chemistry. It tells us how the body is handling sugar.
But here's the catch. The results don't only depend on the lab work. They start with the patients. Fasting, diet, or even a cup of coffee can make or break the accuracy of the test.
That's why patient preparation is crucial. Without it, it might lead to mislead doctors and wrong decisions for the patient's care.
So to make this clear, let's look at different glucose tests, each one with its own set of instruction, and each one shows just how important preparation really is.
Good morning, sir.
Good morning, ma'am. Can I have your requisition form? Okay, so just for confirmation, ma'am, can you please state your full name and age?
Sana Rose Iclanza, 20.
Okay, so you're here for fasting blood sugar test, right?
Yes, that's right.
So did you fast for 8 to 10 hours, only water?
Yes, I did.
Perfect. So no coffee, juice,
No.
anything? No. How about exercise, smoking, or medication today?
Nada.
Perfect. Okay, so thank you, ma'am, for following your instructions. So please have a seat and we'll get your answers.
Fasting blood sugar only gives a snapshot. For a more detailed look at how our body handles sugar, we use the oral glucose tolerance test.
Hello, sir. Good day.
Hello, ma'am. Are you here for your oral glucose challenge test?
Yes,
Okay, you can see it right here. Can I get your requisition form, please? Thank you. Can you state your name, ma'am?
I am Reynolds.
Merly. Okay, ma'am, Merly. So for this test, you don't need to pass beforehand, but I just want to confirm, did you take your lunch today?
Yes, just my usual lunch hour.
That's fine. This test usually done during pregnancy on how your body handles sugar. What will happen is, you'll drink a sweet glucose solution, then after 1 hour, we'll collect your blood sample. Ma'am, please drink this within 5 minutes.
Alright, thank you.
Thank you. And now, come back for 1 hour, and we'll test your blood.
Okay. And what if the result isn't fun?
If your oral glucose challenge test is higher than expected, we'll schedule you for oral glucose tolerance test.
Okay, thank you.
Tests like OGCT and OGTT are important, but they use a special glucose drink. In real life though, people eat regular meals, and sometimes we need to see how the body handles sugars from food. That's exactly why postprandial blood sugar is the test for it. So in oral glucose tolerance test, the patient will need to fast overnight, usually 8 to 12 hours. First, we'll take your fasting blood sample, then you'll drink a stronger solution, 75 grams, and we'll collect blood sample at timed intervals, usually after 1 hour and 2 hours. This tells us more precisely how your body handles sugar. So basically, OGCT is more of a screening test and OGTT is for a confirmatory test. Good morning, ma'am.
Hi there, good morning. Can I please have your requisition form, ma'am, please? Okay, thanks. Can you please state your name, ma'am, for clarifications?
Jerly Valdez.
Okay, thank you, Miss Valdez. So you're here for the post-meal blood sugar test, am I correct?
Yes.
Okay, so for this test, we just need to check for your blood exactly 2 hours after your normal meal. So when was your last meal, ma'am?
About 2 hours ago.
Okay, perfect. So it's the right time to get your sample now. So let's go ahead.
The PPBS only gives us a snapshot after a single meal. But what if we want to test a person's average sugar levels over the course of months and not just hours? That's where HbA1c comes in. A test with no special preparation at all.
Unlike other glucose tests, Miss Mag-aso, this one doesn't require fasting or special preparation. You can eat and drink normally. HbA1c shows your average blood sugar over the past 2 to 3 months. Now, what happens if patients don't follow the rules?
For fasting blood sugar, if you sneak in breakfast or even just a coffee, your results can shoot up and look abnormal, even if you're healthy.
For the glucose challenge or tolerance test, if you eat too much sugar before coming in or don't finish the glucose drink on time, the whole test becomes unreliable, making it harder to know if something real.
Post-meal test. If you eat late or skip a meal, the timing is off and the result lose their meaning.
And with HbA1c, while it doesn't need special preparation, it plays a different role. It shows us the bigger picture of your sugar control over months. Ignoring it means missing the long-term story of your health.
Bottom line, every instruction matters. Skipping them doesn't just waste the test. It risks missing the chance to catch diabetes early, when it's most treatable.
So, we've seen how much each glucose test works and why preparation matters. From fasting blood sugar to glucose challenge tolerance test to post-meal checks and even HbA1c for the bigger picture, every single test tells a part of the story. And even when patients prepare the right way, we get the truth. Results that can guide better care and meet
Patient preparation isn't just a step, it's the key to accurate diagnosis.